Hey guys, welcome back to my channel. So today's video is going to be, I think, an amazing video. And the reason for that is because I am actually going to take you along to my med spa where I get my lip injections done so that you guys can share the experience with me. I decided to do this video because so many of you guys have asked so many questions ever since I shared that I get lip injections done. And so I compiled a list of your questions and I'm gonna ask my PA, Tanya, all of these questions so that you guys have them answered for you. I know that when you're trying to get something done, like your lips, like Botox, like any type of injectable, we have a lot of questions, right? Like, especially if you've never done it before, you can be super nervous and it's totally understandable. Okay, guys, so I hope you guys enjoy the video and I will see you. So this is Tanya, she's my PA and she's here with Miami Plastic Surgery, and I am going to go ahead and ask her the questions that you guys sent me. So the first question is, what is the difference between the fillers?
There's different fillers that you can use, especially for the lips. The most common is going to be Restylane, or what we use on you, which is the Juvederm. There's different types of Juvederm. There's Juvederm Ultra or Juvederm Ultra Plus. One is just a little bit thicker than the other. The way to determine what is the best product for you is to see the person that's going to be injecting you, let them look at your lips to see if it's the size that you want to just improve, if you want to add more volume, or if you want to actually change the shape of the lip, because it depends more on what you're trying to achieve, so that will choose the correct filler for you.
Right. Okay, next question is, what fillers are best for the lips?
The best fillers are going to be the Restylane or the Juvederm.
Okay. Which filler lasts longer?
You'd have to honestly try them both. A lot of people will say, oh, well, the Juvederm lasts me so much longer than the Restylane, but you'll never really know 100% unless you give them both a try. I can't say in my 6 years of injecting that, oh, this one for sure lasts longer. It really depends on the patient and how they break down the different fillers. What's great is that you now have a choice. You know, back in the day when the fillers first came out, there was just Restylane. So if Restylane didn't work well for you, we didn't have any other options. So basically, it's good to try them both out. But again, it goes back to the first question. It depends on what look you're trying to achieve. One will give a little more of a plumping look, which is the Juvederm, and then the Restylane is something we'll use for a little more structure in the lip.
Okay. I prefer the Restylane. I mean, I prefer, I'm sorry, the Juvederm. Yeah, I started with Restylane, but I do prefer the Juvederm.
Perfect, so you actually got to try them both out.
Exactly.
That's good too. You'll figure out which one you favor.
Right.
Yeah.
Right. Okay, so the next question is, are there different techniques that can be used?
Yes, there's different techniques that can be used, and not to get too technical for you guys, but you can do lips by either just injecting it with a needle, which is what most people see. There's also a cannula, which is you make an entry point with the needle and you kind of thread a cannula into the lip and you're able to put product down that way. You can do it with little serial punctures, little tiny, blobs of product underneath the skin, or you can thread it. So there's different ways to do it, but again, that also goes back to the look that you're trying to achieve. Not one exact method is going to look the same on everybody, so you really have to make sure the person that is injecting you knows how to use these different techniques for you.
Okay, yes, don't do it out of, just anybody, please.
Yeah.
Okay, can you be allergic to the filler?
Allergies are not common with fillers. Usually if somebody's allergic to something, I've had experience where they've been allergic to the topical numbing cream, which is basically a benzocaine, lidocaine, or some kind of tetracaine mixture. But I've never in my experience had anybody with an allergy to the actual product itself. There are some fillers out there. There was one filler where you did have to get testing beforehand because it was a bovine collagen, but we don't use that in this practice.
Now on me, you don't use the numbing cream, right?
No.
Because you said...
I actually prefer not to use the numbing cream. I find that it does plump the lips up a little bit, and in order for me to get full correction, I kind of just want to see how your lips are with absolutely no alteration whatsoever. But we do use ice. I have a little device that I'm using now, which actually is like a vibrating tool, so you guys are going to see that today, which is exciting. We've actually never done that on her before, so you'll be able to kind of see how that cuts down on the discomfort and pain.
Okay, cool. How much do the syringes cost?
Syringes for the lips can range anywhere from $600 to $800. It depends again on the product that you're using, who's injecting you. I know in some states people charge a little less, or some people charge a little more. It just varies, but usually typical it's $600 to $800 a syringe.
Okay, any bruising or bleeding?
That is always a possibility because we're sticking you with a needle. The way to cut down on that is to, let your provider know, hey, I've been drinking the night before, or I just took a whole bunch of aspirin, or something like that. We want to make sure that we just don't blindly inject, especially if you're on certain medications that could induce more bruising or more bleeding. We always try to avoid that. That's not ever something that we say, hey, let's bruise this patient right now. So if we see that we're in a place that it's uncomfortable or there's bleeding, we're going to stop, wait a couple of minutes before we continue the injection. If I just kind of keep going, boom, 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 you're going to have more swelling and bruising than that's necessary.
And she's very gentle, guys.
Yeah,
so
slow is the way to go.
For sure.
I've had my lips done before as well. I know what it feels like, so I try to always think of that when I'm injecting patients so that, it's not just like 15-minute quick in and out. Although it can be a fast procedure, we want to make sure we have enough time to, if something does happen, if there is a little bit of bruising or bleeding, we want to kind of take our time with it.
Okay. How do you fill without getting duck lips? I know that's a big question because so many people are walking around with duck lips.
Yeah, so really what's something to consider is your profile. Usually when I take pictures, I like to take a picture from the straight position and I like to take a picture from the profile because we always look at ourselves in the mirror and we do this and we do that and we can see certain angles, but when you see a profile, that's when other people say she has duck lips.
Right.
So if we don't take all those angles into consideration, then it's not going to look balanced or proportioned. And you can see us talking here, the mouth is just moving, everything's, doing different things. So we want to make sure that no matter if you're not smiling, if you're smiling, if you're making a kissy face for a selfie, that it looks good no matter what angle you're at.
Yeah. Okay, good. What if my lips are very thin? Will the filler still work?
Absolutely. Fillers are great for patients who have thin lips. It's not meant for somebody who just wants to build on, if they have bigger lips, they can build on that too. But we get probably more patients that have thin lips more than anybody else. And the way to do that is not to fill them all up, in that first session. You want to take your time and do little by little, especially if the lips are very, very thin. A great thing is to send in some pictures. Bring in pictures and say, this is what I'm looking for, or this is what I don't want. That way you can make sure you and your injector are on the same page and it's more of a collaboration rather than them just doing whatever they think is going to look good. But you definitely have to take your time and maybe do several sessions, maybe every couple of weeks when you have thinner lips, depending on how big you want to go. You never want to pack in too much at one time because it'll be very tender. You can definitely have more swelling, more bruising, and we want to cut down on those complications.
Right, of course. Take it easy, girls.
Yeah.
You don't want to just
go slow.
Go out. Exactly.
Yeah. And it's more gradual that way too. You don't want to go, from work on Friday and show up Monday and, your lips are completely different.
Exactly.
It'll be nice if it's more subtle and natural.
Yes, I agree. I couldn't agree more.
Yeah, good questions, yeah.
Okay, awesome. So now you guys are going to see, and, I think this will answer all your questions because I get a lot of questions on, does it hurt? So you guys will see me now in the hot chair. So,
yeah. I'm going to clean your lips, remove any makeup or anything that might be on there. We want to make sure that they're really clean before we inject. Don't want to introduce bacteria, especially since it's, it's next to the mouth. There's always concern with that. So, all right, so this tool is a little vibrating tool, so you see how that feels?
mm-hmm.
So I'm going to just place this around. I'm actually using it almost like I would my other hand. Okay, so here we go. We're going to inject here. Let me know if anything feels out of the ordinary. You okay?
Yeah.
This is better, right?
Oh, yeah.
You still feel it a little bit, but it's nowhere near as uncomfortable.
I don't feel that at all.
You know me, I go boringly slow.
also wanted to share what my lips look like today. Today is Wednesday and I did them on Thursday of last week, so it's been a little bit over, or it's been a little bit under a week, and this is what they look like. We did use Juvederm, which you'll see in the video. I prefer Juvederm over Restylane. I know I kind of touch on that quickly in the video. I prefer it because in my opinion it lasts longer and it gives me a better shape, I feel like, on my lips, so I definitely love that. And I did get some bruising around here, but Tanya's amazing and she always checks on me, like, not just because we were filming, but she just checks on me even when I, like, years before. She's always checking on me and seeing how I'm doing, and she's always asking me about bruising. And usually I don't really tend to bruise. Like, I sometimes bruise like in these areas, which is where some of the injections go, but this kind of was new to me. So I went into the Coral Gables office and she zapped me with a laser. She also zapped the ones around my lips that I had, which, like I said, are the ones around here, which those are like usual. Sometimes I get them, sometimes I don't. But yeah, this one is basically gone. Like, it's been, yeah, almost a week. It was the worst probably, I don't know, like the second, third, fourth day. It was like you could see it. After the laser, it looked like they kind of expanded it and lightened it. And then after that, like a day, it was like gone. So yeah, you could I mean, I still have like a smidge left, but barely anything. So those are things that I think are important to share with you guys, because, you know, that's one of the biggest questions that I think I got was, do you bruise? Like, do you get swollen? You know, it just depends on the person. I usually am not like a bruiser, but this time I did. So it's always like important to show and share experiences, because there are things that can happen, and you know, it is what it is. Swelling, yeah, swelling is normal. I'm usually more swollen like 1 or 2 days after, but nothing, you know, insane that I'm gonna be like, oh my god, I don't want to go out, I'm hiding in my house or anything like that. So I hope you guys enjoyed the video. If you like these type of videos, let me know and I'll definitely do more, because I think they're super fun and super informative. So yeah, don't forget to subscribe, follow me on Snapchat, follow me on Instagram, and I will see you guys in the next one.